Ladies and gentlemen, my name is Subrata Sarker. I'm a mechanical engineer working in manufacturing industry since last 22 years. Today I'm going to share the topic, this healthcare industry, the rather growth of healthcare industry in India, because it is one of the fastest growing sector in India at this moment. If we go through some statistics, like compounded annual growth of healthcare industry in India as on date is 17%, and the total turnover of Indian healthcare industry in 2017 is 160 billion US dollar. Not only that, if we consider the foreign direct investment in Indian healthcare industry in 2016, you can see here only in the drugs and pharmaceutical industry, the foreign direct investment is done 14,000 billion US dollar. So from that you can understand how big is the healthcare industry in India. And most importantly, there is a huge future growth in healthcare industry in India. I'll show you some data so that you can also understand. There are a lot of area where there is a lot of scope of business expansion in healthcare industry. So it is one of the fastest growing business sector in India, you can say. You can see here the employment percentage. If we consider, that is 4% people are employed in India in healthcare industry, where in manufacturing sector is 11%, construction sector 11%, and in education sector total people employed is 2%, whereas healthcare is 4%. Even altogether in government sector the total employed people are 2% and healthcare is 4%. So healthcare is providing double employment than the government job in India at this moment, and it will be growing in future. You can also see now when healthcare industry is growing, at the same time the other connected industry like the health insurance companies are also growing at a very faster rate. You can see here the health premium insurance collected in 2017 is 6 billion US dollar in India. There is almost 40 major companies in India for healthcare industry, and there are also compounded annual growth for healthcare industry like SDFC life insurance, SBI Life, Kotak, and all these. So they have also growing like anything. But there is a difference obviously in government and private healthcare industry, the quality, the cost. You can see here in these photographs in government hospitals, actually it's not that there are good doctors are there, but good facilities are not there, good infrastructures are not there, and things are not sufficient. Like there are 100 beds and the patients are coming 500. So in this way people are taking care actually. So nowadays people are also, those who have little bit money, people are not interested to go into government hospitals. But in the private hospital at the same time, it is like 5-star luxurious actually, you can see. And treatments are also very prompt, but at the same time cost is much higher. Obviously it will be higher because quality has a cost always there. So proportionately the cost is 4 times more in private hospital for the same treatment, same treatment rather, you can say in altogether. But still 70 to 80% people are going into the private sector for their healthcare purposes. If I share some data for healthcare industry, like presently there are 8 lakhs practicing doctor in India. There are many doctors coming out from MBBS colleges, having degrees, MBBS degrees from different medical colleges. I am not considering those. Those who are working in industry, in the hospitals, I am counting them, that is 8 lakhs in India at this moment. And there are 15,000 hospitals in India at this moment. I am not considering the small nursing homes and etc. in local areas. In 15,000 hospitals, there are 8.75 lakhs bed as per 2017. Now, cost of healthcare in India is going, is a very high rate actually. Like for 2018, if we consider the government or private hospital, actually in one day it's coming about 50,000 to 1 lakhs cost. So how people will be actually, it is very going to get a very difficult situation for the people actually. Like if you are getting admitted in a hospital, in 2 days 3 days bill is 2 lakhs 3 lakhs. So this is the advantage actually taking by this healthcare health insurance industry. You can see here also, like health insurance industry is not yet grown. It has gone up to this much and it will be growing like this, because you can see here in this picture, like 86% people in rural area without health insurance policy. Even in cities, the 82% people are without health insurance policy. So people will be obviously taking health insurance policy in future. So there is a huge market actually for this health insurance companies, and like for Max Life, SBI Life, Tata ERG, LIC, and a lot of companies, like for example Excite is a battery manufacturing company. Now they are getting into this health insurance company because there is a huge market. Kotak is a banker company, they are into health insurance area. So people are also getting day by day in health insurance sector, because this is a highly profitable and a highly growing sector for near future in India. And from my suggestion, whenever you are doing any health insurance, you must check the claim settlement ratio by that company. You will find this information in many internet, and you can cross verify all this information. At least company has to have more than 95% claim settlement ratio. Only you can go with them, like HDFC, SBI, LIC. They are much more, better from a claim settlement point of view. Because many times what happens actually, like premium is lesser. There are many companies, but they are not settling the claim. During settlement of the claim, you will find a lot of problems actually. So what is the use of having a small lesser actually premium? So premium is also, you can see here in this picture, in the last 5 years, premium for health insurance companies are also doubling in 5 years. Now, for government health budget, there is one demotivated figure here. You can say health budget for Indian government is the poorest. You can see here, even Bangladesh has got much more health budget than India. So this is the area where government need to do a lot. That's why today we are getting 10,000 rupees treatment in private hospital in 1 lakh rupees, because they are also having that opportunity, and government is not contributing anything actually in these healthcare areas. You can see here in the country, like so big countries like India, their budget is so less actually. Rather you can say it is the least, much is half than the China. Even Bangladesh has got 1.5 times more budget than India. It is very surprising, and it's very shocking. Now, if we summarize this Indian healthcare industry, or summarize this presentation, so turnover of Indian healthcare industry is 160 billion USD, and CAGR is 17% as per 2017, and Indian healthcare industry is contributing 5% of the GDP of India, and employment by healthcare industry is giving 4%, which is double than government employment, and healthcare insurance premium is 6 billion US dollar, where their compounded annual growth rate is 22%. So in future it will be growing like anything, and there are 8 lakhs practicing doctors actually, and there are 15,000 hospitals, not counting small nursing homes in these local areas, and there are 8.7 lakh hospital bed, and there are 7.5 lakh nurses, there are 170 medical colleges, there are 3.5 lakhs retail pharmaceutical shops, there are 18,000 new doctors passing out from medical colleges having MBBS degree in every year. So if you find this presentation is informative and has given some new information to you, you can share this presentation with your friends, maybe through WhatsApp. You can subscribe my YouTube channel so that you can get the future presentations. Thank you very much for your attention.